Hi all. Today we are discussing about diabetic ketoacidosis. Then what is diabetic ketoacidosis? It is a state of absolute or relative insulin deficiency leading to hyperglycemia, ketone production and metabolic acidosis. That is, there is an absolute or relative deficiency of insulin that may be due to type 1 diabetes. There is insulin production is relatively decreases. That is, absolute or relative decreases of insulin production can lead to diabetic ketoacidosis that causes hyperglycemia, ketone production, and metabolic acidosis. Then, what are the causes of diabetic ketoacidosis? So, the major causes of diabetic ketoacidosis is undetected diabetic mellitus. So, if we are not detected the diabetic mellitus, then this diabetes mellitus is complicated into diabetic ketoacidosis. The next thing is stress. So stress will causes increases the cortisol level that in turn causes increases the glucose level in the blood. That increased glucose level will cause increases the demand of insulin and that will lead to diabetic ketoacidosis. And some other causes is there is 3S, that is stress, illness. Illness is sickness, or stress there is a causes, and illness or sickness or sepsis is also a cause of diabetic ketoacidosis. Or we are using corticosteroids that will increases the glucose level in the blood and it causes diabetic ketoacidosis. If a patient is in corticosteroids, there is an increased chance of getting diabetic ketoacidosis, prolonged corticosteroid. That is why when we are giving dexamethasone to a patient, we will taper it and then stop it. So we are not abruptly stopping that corticosteroids. That will lead to complications of diabetic complication, that will lead to diabetes and in turn leads to diabetic ketoacidosis. Then skipping meals. If we are skipping meals, there is a chance of getting used fat body fat can be used for energy source and that in turn leads to diabetic ketoacidosis. Then next one is, we already said that diabetic ketoacidosis is mainly occurs in type 1 diabetes, but if you are in type 2 diabetes and you are not taking insulin properly, then that will lead to the complication called diabetic ketoacidosis. Now we are going to discuss with signs and symptoms of diabetic ketoacidosis. The first one is Kussmaul's breathing or Kussmaul's respiration. Why they are occurs? Because in diabetic ketoacidosis there is metabolic acidosis. In order to compensate with this metabolic acidosis, the respiratory mechanism will activate and that will create a rapid and swallow respiration that causes Kussmaul's respiration. Then this breath has a fruity smell because of the ketone accumulation. The second thing is the renal system will activate to compensate with this hyperglycemia. So there is polyuria will occurs. In turn, this polyuria will causes increased thirst and increased water intake will occurs. That is polydipsia. And the accumulated ketone will causes nausea and vomiting. This nausea and vomiting in turn causes dehydration, hypotension, and confusion. These are the signs and symptoms of diabetic ketoacidosis. This is the pharmacological management of diabetic ketoacidosis. So first thing is regular insulin. So Regular insulin can be given to reduce the blood glucose level and stop ketone production. And the drug can be give us bolus, that is 0.1 unit per kg, that is optional, and we can continue the infusion as zero point 0.1 unit per kg per hour. The thing we have to take care is that titer based on the blood glucose, that is it's aimed to reduce blood glucose by 50 to 70 milligram per deciliter per hour. Then second thing is potassium chloride. So correct hypokalemia caused by insulin and fluids. So we are starting insulin, there is a chance of getting hypokalemia, and in order to correct this, we have to provide a potassium chloride, that is 20 to 40 milliequivalents per liter of IV fluid, per liter of IV fluid. Then do not give insulin if potassium level is less than 3.3 millimole per liter. First we have to correct potassium in that case. Then second thing is sodium bicarbonate. Sodium bicarbonate to correct severe acidosis, because if the pH is less than 6.9, then we can give sodium bicarbonate, that is 50 to 100 millimole in 200 to 400 milliliter over 1 to 2 hours. Use only in severe acidosis. Then we can give fluids. Example, normal saline, dextrose 5%. First, we have to rehydrate and maintain fluid balance, because there is dehydration occurs due to severe nausea, vomiting. So, we have to rehydrate the patient using fluids. Then start with the 0.9% sodium chloride, then switch to 0.45% sodium chloride. So in these cases, we also monitor for the sodium potassium level. Then we can add dextrose when the blood glucose level is less than 200 to 250 milligram deciliter. So the patient is already in insulin, so there is a chance of getting hypoglycemia. So in order to prevent that hypoglycemia, we can give a dextrose, 5% dextrose as fluid. We can combine that as potassium chloride in dextrose can be given in order to avoid the hypokalemia and also avoid hypoglycemia. Not a drug, but essential to manage DKA management, but essential for decay management. Then we can give antibiotic if infection is present. If the diabetic ketoacidosis is occurs secondary to an infection, then we can give antibiotic, treat underlying causes, that is infection. The underlying causes for that diabetic ketoacidosis is infection. So first of all, we have to treat the underlying causes. Then based on the sources of infection and culture result. So the culture result and sources of infection, we have first to treat the underlying cause. Empiric coverage until specific cause is found. So the culture result will take 1 to 2 to 3 days. So we can start an antibiotic in order to reduce the effect. So these all are the pharmacological management of diabetic ketoacidosis. Thank you.